Okay, guys. The last blood video didn't record, so we're going to try this one more time. Okay. Last piece of cardiovascular system we have to discuss is blood. Everybody's favorite. Okay. So we're going to start off with the basics. What is blood? Blood is connective tissue, which I hope we remember from AMP1. Do we remember? We hope. Connective tissue was unique in that connective tissue had cells, and that was the living part. And then it had a non-living part, which was called the matrix. Okay, the cells were suspended in the matrix. The cells we'll get to in a minute. The matrix of blood is blood plasma. Okay, so we're going to start by talking about first what blood plasma is, what's in it, and then we'll move on to the cellular piece. First thing we want to kind of general things about blood. How much blood do you have? Anywhere from 4.5 to 5 liters of blood in an average sized person. Okay, blood plasma makes up about 55% of your total blood volume. Okay, so now we're going to talk about what is in your plasma. All right, so blood plasma. So we go to the doctor and they're going to do a venipuncture. So we say, why do they puncture a vein and not an artery? Well, because if we puncture an artery, because the pressure of blood in your artery is so high and the blood's moving so quickly, it'd make a big mess. Add to that the fact that arteries are deep and veins are superficial. So they're closer to the surface of the skin. They're a little bit more accessible than your arteries. Now, that being said, you can take blood from an artery. It just has to be done in a different mechanism than a venipuncture would be. Would everybody like to see Maddie? No. Say hi, Maddie. So. We should have had Maddie when we were doing blood pressure, as hers is up because she's exercising. So, blood, we have our venipuncture done. They draw the blood into a tube. That tube is what's called heparinized. It contains something called heparin. Heparin is an anticoagulant. It prevents the blood from clotting at room temperature. So you ever watch them take the tube off the port or however you're having your blood drawn, they take the tube and invert it a little bit. They're mixing the blood so it comes in contact with heparin in the tube, and then it won't clump up and get coagulated, and then it's really not usable. So then they stick the blood in a centrifuge. Centrifuge is going to spin it around at a certain number of rotations per minute, and what will happen is the blood will start to separate based on its density. What you would see if you looked at the separated blood is a very kind of yellow looking layer, kind of the color of straw. And that layer at the top would be your blood plasma, okay? Blood plasma is about 90% water. So we learned in AMP1, I'm not sure that we remember, but so we'll just cover it quickly again. Water is a universal solvent, so that means many, many things can dissolve well in water, and so that's super important because lots of things are going to be transported in your blood plasma. So, for example, what's in there? You have your ions, ones we've been talking about in terms of cardiac, sodium, potassium. You have minerals like calcium would be present in your blood plasma as well. Nutrients, things like glucose, fat, like cholesterol, protein. So again, if you're having cholesterol testing done, this is where they're getting that information. You have your antibodies that function in immunity. This is what we all wish we had now, antibodies to coronavirus, so that we didn't get sick and we could all go back to school. Hormones. All the hormones that we talked about in the first part of the course All of the hormones that we discussed, we said, oh, you would look at blood hormone levels. This is where you would pull from to do an assay to see what types of hormones we're looking for at what level and for what reason, right? So we're going to have ions, nutrients, antibodies, hormones, all important. Other types of functional proteins that are important for building, okay? Remember, we have to have amino acids present so that we can build out different tissues. Those would be present in the plasma as well. So your plasma carries a tremendous number of things that are super important. One thing we'll discuss when we hit the respiratory system is bicarbonate. Bicarbonate acts like a buffer and helps buffer your blood at its appropriate pH, which we will discuss when we hit the respiratory system, as it's absolutely more relevant there. So that's our matrix. So now we have to talk about our formed elements, or our cellular elements of blood. Okay. We remember from A&P1, you had two different types of bone marrow. You had yellow bone marrow, which was fat, and you had red bone marrow. The yellow bone marrow is in the shaft of the bones. The red bone marrow, you'd see more at the ends of the bones, for example, or in some of the flat bones. In your red bone marrow, there was a type of stem cell called a hematopoietic stem cell. So when you see this prefix, the HEMA, that think hema like hematology, we're thinking blood. This hematopoietic stem cell is going to give rise to all of the cellular or formed elements of blood. So we have three general classes of these. You have your red blood cells, your white blood cells, and then the platelets. Okay? This cell line has to continually regenerate so that it can support the production of red blood cells, white blood cells, and platelets all the time. Okay? When someone is undergoing treatment for cancer, that becomes a challenge, because if someone's undergoing chemotherapy, it could potentially knock out the ability of this cell to reproduce itself quickly enough to produce all of these formed elements. So then someone who's being treated with chemotherapy would have lower blood cell counts for things like red blood cells, white blood cells, and platelets. Some of these are easier get arounds than others. A big problem for people who are cancer patients who are doing chemotherapy is going to be that their white blood cell count can become dangerously low, which is why it's advisable if someone's on chemo that they should not be out at the mall. They shouldn't be in large groups because they are immunocompromised to some degree. Okay, so the red bone marrow is going to be the site where the stem cell lives, and the stem cell is going to produce all of these. The red blood cells, which we'll talk about now, white blood cells, and platelets. Good?